Assalamualaikum and good morning to one and all. Today we'll study about part 1 of antidepressant drug. I am Professor Sheikh Abu Sufyan. Welcome you to S Academy Learning Forever. At the end of this e-learning session, you are able to discuss its clinical symptom, define depression and explain monoamine and endocrine theory of the depression. Let's study about introduction and the definition of the depression. What is the meaning of the depression? What exactly happen in case of such disease? Okay, so the depression, it is basically defined as disorder of the mood rather than disturbance of the thought. So we have seen in case of the psychosis. So psychosis or the schizophrenia, it is basically the disorder of the thought where there is implication it is occur in the thought and thought it is disturbed. But the depression, it is basically the disease of the mood. Here mood it is affected. So mood it is either depressed or it is excessive mood. Okay. So in case of depressed mood, the patient will sit quiet and isolated. Whereas in case of the excessive mood, the patient will show the overconfidence, exuberance and the excitement. Right. So basically there is some problem it is occurred in the mood rather than the disturbance of the thought. So depression, it is defined as the disorder of the mood rather than disturbance of the thought. Let's see what is its prevalence, how it is effect in the population. So from population to population, it afflict approximately 5%. So its ratio it is 5%. But out of 100, 5% of the people they may suffer from. In case of psychosis, the affliction it is just 1%. So the depression it is occur at a higher rate because 5% of the people from population they suffer. In case of psychosis, only 1% of the people they are suffer from psychosis. So out of this depression, amongst them 25 to 30% of patients they show suicidal tendency because they reach to the stage where they lose all hope of their life. There is no interest in their life and they feel that there is no way in living such life and they undergo the suicide and they try to commit the suicide. So this suicidal tendency, it is seen in case of 25 to 30% of depressed patient. So if we verify this depression or if we compare depression amongst men and women, then in case of the women, it is 2 to 3% higher. So it is 2 to 3% higher in the women. So to summarize, the prevalence of the depression is such that it is little higher as compared to schizophrenia. So 5% of the population they suffer from depression. Out of these people suffer from depression, 25 to 30% of the people they should be compared from the men and the female. It is 2 to 3% higher in case of the women. Okay. So when we talk about the normal life, what happens when the patient suffer from the depression? So it is disability and premature death. Reason is that the depressed patient it is present in immense stress. So he is undergoing immense stress and as a result of that stress, he suffer from other disorder, disease and the cancer because the root cause of the heart disease and the cancer it is the stress. And we know that since depressed patient he is in immense stress, he show the premature death and he generally die due to the premature death which is occurred due to heart disease or the cancer. Okay, so this could be the problem in case of the depressed patient. When the patient suffer from the depression, so disability and premature death. Okay, there are times, so I will be continuing now. So as we have discussed, it is the major premature death because depressed individuals are more likely to die from heart disease or the cancer. and major reason of the heart disease and the cancer, it is the excessive stress that depressed patient it is undergoing. Okay, next part, it is clinical symptom of the depression. Now let's see what are the depressed patient. So first symptom, it is the emotional symptom, and second symptom, it is biological symptom. So let's see which are shown by the depressed patient. So the first symptom amongst emotional symptom, it is the misery and apathy. Now what is misery? He will lose the interest in the depression. Earlier he was interested in the study and he used to enjoy the study, but now after suffering from the depression, that student will not show any interest in the study. Likewise, some person, they are highly excited with their some hobbies. Like for example, if when they get opportunity to swim, they become very happy, isn't it? If such patient, they are suffering from depression, swim. So earlier they used to happy, but now after suffering from apathy, that is the complete loss of the interest, so they will not show any interest in the swimming. Likewise, they show the symptom called as the pessimism. So pessimism, it is the worst thinking. So always they having the negative thinking. In case of the depressed patient, so they always nothing, everything is the bad, and these also force depressed patient to undergo the suicide or to show the suicidal tendency. So the emotional symptom, it is one of the problem. Depressed patient, they having the lowest patient, so it is very common, and they show the inadequacy and ugliness. So since they feel always they feel the guilt. Okay, so अपने आप को हमेशा वो गुनहगार समझते हैं, and this due to that in their own eye there is no any what will I say, in their own eye they will not take any interest, because they always feel that they are the guilt, they are the wrong person, and they are not doing something which is good. Okay, so always there is feeling of the guilt is there. So that is the one of the symptom of the depression, that is called as the low self-esteem. Okay, next one, it is the indecisiveness. So indecisiveness, it is the symptom, it is non-conclusive in nature. So if you with such patient and you ask to take the decision, then they will say, okay, go ahead, you do as you want, as you want. Okay, no matter how much that discussion it is important for his life. Okay, so he will always non-conclusive, or whatever decision he will take, those decisions are not right, because he suffer from the indecisiveness, where he will not able to take the rational conclusive in nature, and there is loss of motivation. So these are the emotional symptoms. So to summarize, first one, it is the misery and apathy, the low self-esteem, and third one, it is indecisiveness. If these symptoms are there, then it is called as the emotional symptom of the depression. Now let's see the second category of the symptom which is manifested by the depressed patient. It is called as the biological symptom, where the depressed patient, it starts showing the biological symptom. For example, there is the sleep disturbance. Those patients will not able to sleep, so they are suffering from the insomnia. Okay, so they are suffering from the insomnia, and there is loss of appetite. So insomnia along with the loss of appetite. So if this is the symptom which is shown by the depressed patient, then it fall under the biological symptom. Okay, next symptom, it is the retardation of the thought and the action. Like suppose if you want to tell that if you have tell that depressed patient to think and take certain action, he will not even think in the way you are asking, because there is no control on his thought. Okay, so thought are disturbed because there is the worst thought he is undergoing, and since the thought it is disturbed, their action are also disturbed. Okay, so the retardation of the thought and action, it is also one of the problem which is the depressed patient is suffering from. Next one, it is the loss of the libido. So there is the sexual problem, it is seen in case of the depressed patient, and there is the loss of libido. It is one of the characteristics or the biological symptom of the depression. So these are all the clinical symptom of the depression. Now we'll see what are the two distinct type of depressive syndromes which is seen in case of the depression. So there are two types of basically depressions are there, and due to these two different types, the depressions are classified into those categories. So the first category, it is unipolar depression. So what happen in case of the unipolar depression? The mood it is swing are always in a same direction. So when mood swing it is in a same direction, then it is called as the unipolar depression. It means suppose the patient is undergoing the depression, okay, so he always remains in a depression, and this depression it is more and more, then it is called as the unipolar depression. Likewise, if patient show aggressive tendency, and when he become more and more aggressive, then in such cases also it is called as unipolar depression, because mood it is going either depressed or it is aggressive. So it is only in one direction, so it is called as the unipolar depression. Second category, it is the bipolar affective disorder. So the bipolar affective disorder, here you see there is complete change in the mood of the patient. The first may be the patient suffering from the depression, and then he may suffer from the mania, that is the aggressive tendency. Okay, so the depression alternate with the mania. So what is happening in case of bipolar disorder? Mood it is swing from depression to the mania. If such type of symptom or syndrome it is seen in case of depressed patient, then it is called as bipolar affective disorder. Okay. So what is mania? So we have seen the depression and we have seen the different symptom of the depression as well. Now let's see what do you mean by mania. So the mania, it is exactly opposite to the depression. What is happening in the depression? There is no interest. Okay, there is low self-esteem. Whereas in case of the mania, the patient will show the excessive exuberance. So there will be the excessive. He will start showing excessive interest, or he will be over excited, or he is more enthusiastic. So excessive enthusiasm it is seen. Okay, the self-confidence it is increased. So there is we call it as the overconfidence, because there is more confidence, and it is accompanied by the impulsive action. Now, since he is suffering from the overconfidence, like for example, if I ask you to jump from the first floor, what you will do? You will not jump from the first floor. Why? Because you have fear that you may suffer from the fracture, or you may die because you are jumping from very from the high floor, or you are jumping from the first floor. Okay, but since this patient suffering from the mania, he having the overconfidence, there is excessive enthusiasm and exuberance, he will don't care, he may jump from the first floor. So what is this? So there is excessive exuberance, enthusiasm, overconfidence, which is accompanied by impulsive action. So jumping from first floor due to overconfidence, it is called as the impulsive action, which is shown by the patient suffering from the depression. Okay, so we have seen the depression, it is of two types: unipolar depression, where mood is swing, either he is suffering from depression and going more and more into the depression, or he is suffering from the mania and becoming more and more manic patient. Whereas in case of bipolar affective disorder, there is patient show two types of mood. Either he is suffering from the depression, or he is suffering from the mania. So sometime he is suffering from depression, and the mood it is suddenly swing, and he show the symptom of the mania. Okay, so this is what exactly happen in case of the depressed patient. Now let's see the depression which is non-familiar in nature. What do you mean by familiar depression? So familiar depression, it is the depression which run in the family. For example, if some elderly in your family has the depression, then it increases the risk of their child, or maybe their sibling, they are suffering from depression in the future. Okay, so likewise that depression, it is called as the familiar depression. Whereas there are some depression which doesn't run in the family. Those depression, they are called as the non-familiar unipolar depression. So these are unipolar in nature. Means if patient is suffering from depression, he is suffering from more and more depression. If there is mania, then he will suffer from more and more mania, or he will show the more and more symptom of the mania. Okay, so let's see what is the reason for the non-familiar unipolar depression. So the unipolar depression, which is in the non-familiar in nature, it's prevalent. It is about 75. It is seen in case of 75% of cases. Means if 100 patients are suffering from the depression, then out of those 100 patients, the 75 patients they are suffer from non-familiar unipolar depression. Now let's see what could be the reason for this. So it may be associated with stressful life event. Maybe he is suffering from very stressful event in his life. For example, he may lose a very near and dear one from his family. He has the factory and there is fire in the factory and he has completely lost whatever he had, isn't it? So what is this? This is sudden extreme stress or extreme stressful condition. So this extreme stressful condition which is accompanied by the symptom of the anxiety, because he always have the fear what will happen in the future, and due to that fear he suffer from the anxiety and the agitation, and this stressful condition or extremely stressful condition along with anxiety and the agitation, it is mostly responsible for the unipolar depression. So this is the reason for the unipolar depression. And since this depression it is occur as a reaction to the stressful life event and anxiety and agitation, so since it is the reaction to this type of depression, they are also called as the reactive depression, because this is occur as a result of reaction to the stressful life event, anxiety and agitation. So it is called as a reactive depression. So to summarize, the unipolar depression is occur in 75% of cases. It is occur due to the extreme stressful life event which is accompanied by the symptom of anxiety and agitation. Since it is occur as a reaction to this stressful condition, anxiety and agitation, it is termed as a reactive depression. Second category, it is the familiar unipolar depression. So familiar unipolar depression, it is basically run in the family. Like a parent having the depression, their sibling in future, they may suffer from the depression. So let's see about this depression. So again, this is unipolar depression, but its prevalence, it is just 25%. Means out of 100%, 100 patient, only 25 patient they suffer from familiar unipolar depression. So here the cause, it is not exogenous like the stressful event, it is not a cause, but the cause, it is the something which is endogenous in nature, something wrong in a genetic makeup in that particular family. So that endogenous cause, it is responsible for this type of depression. So it is also called as endogenous depression, because the reason it is not the stressful life event, but it is running in the family due to wrong genetic makeup or abnormal genetic mental makeup. So it is called as endogenous depression. It is unrelated to external stress. So no matter how much the life it is joyful for him, maybe he having everything that he want, but still he is suffering from the depression. That is the unique property of the familiar unipolar depression. So we are done with different type of clinical manifestation and different symptom of the depression. Now let's see different theory of the depression. So first theory of depression, it is the monoamine theory of depression. So what this theory says, it says that, or it states that the depression, it is caused by functional deficit of the monoamine. So there are two monoamine present in the brain. First one, it is the noradrenaline, and second monoamine, it is 5-hydroxytryptamine. So it states that the depression, it is caused by functional deficit of this monoamine. It means there is decrease in level of noradrenaline and 5-HT, which may be responsible for depression. Whereas mania, it is a result from functional excess of the monoamine. Now we have seen in case of depression what happened, the mood, it is going down, the patient, it is depressed, he is isolated, there is loss of self-esteem, there is loss of self-motivation, isn't it? Whereas what is happening in the mania, it is exactly opposite to this. There is excessive enthusiasm, excessive exuberant, which is the characteristic feature of the mania. So if you see in a brain at molecular level, then you will realize that there is decrease in level of noradrenaline and 5-HT if patient suffering from the depression, whereas in case of the mania, there is it is result from functional excess of the monoamine. So there is increase in level of the noradrenaline and 5-HT may be responsible for the mania. Okay, so the depression, it is the result of functional deficit of monoamine, and mania, it is result from functional excess of the monoamine. Okay, so initial hypothesis, when the hypothesis was formulated, it was formulated in terms of the noradrenaline. It was not formulated in terms of the 5-HT. So initially it was only formulated in terms of the noradrenaline. After study it is done, then it was observed that the 5-hydroxytryptamine, it is key mediator in case of both depression as well as the mania. Okay, so to conclude, the thing that is to be remembered is the depression, it is due to the functional deficit of the monoamine, whereas mania, it is a result of functional excess of the monoamine. So this is what monoamine theory says. Now let's see what are the evidences to support this theory. So these are different evidences which basically support the monoamine theory. So let's see the first evidence. So when you give tricyclic antidepressant drug, what tricyclic antidepressant drug they does, they block noradrenaline and 5-HT reuptake. So when reuptake it is blocked, okay, so 5-HT and noradrenaline, it is not going back into the synapse. So since it is not going back into the synapse, their level it is increased. So their level in the synaptic clip it is increased because it is not going into the neuronal what we'll say, it is not going into the nerve ending or into the vesicles. Okay, so their level in the synapse it is increased. Since there is increase in the level of the 5-HT and noradrenaline, it is observed that the mood it is arose. So there is increase in the mood when tricyclic antidepressants are given. So these one first evidence which suggests that the depression it is due to functional deficit, because after increasing level of the noradrenaline and 5-HT, the depression it is reversed, the mood it is improved. So that again in support of the monoamine theory. Second evidence, it is in terms of monoamine oxidase inhibitor. So when monoamine oxidase inhibitors are given, what it does, it increases the store of noradrenaline and 5-hydroxytryptamine. So when level of noradrenaline and 5-hydroxytryptamine it is increased, it is observed that again there is increase in the mood. Okay, so this is again one more evidence in support of the monoamine theory, that is increase in level of the decrease in level of the noradrenaline and 5-HT, it is responsible for the depression. Likewise, when reserpine it is given, what reserpine does, it inhibits noradrenaline and 5-HT storage. So since it decreases the level of noradrenaline and 5-HT, in those patients it is observed that their mood it is going down, the patient is suffering from the depression. So this is the third evidence in support of monoamine theory. Okay. Likewise, when alpha methyl tyrosine is given, which inhibit noradrenaline synthesis. So since it inhibit noradrenaline synthesis, what happened to their level? Their level it is decreased. It is observed that the mood it is going down, and if patient suffering from the mania, that is excessive exuberance, then it helps to calm down those manic patients. So this is the fourth evidence in support of the monoamine theory. Okay. Likewise, when methyl dopamine is given, which inhibit noradrenaline synthesis, it is observed that the mood it is going down. So mood it is going down when methyl dopamine is given. So this is the fifth evidence. Likewise, when electroconvulsive therapy is given, which increase CNS response to the noradrenaline and 5-HT, it is observed that there is elevation of the mood. Since this electroconvulsive theory, which increases the response to noradrenaline and 5-HT, it improves the mood, it again indicates that the depression it is due to functional deficit of the monoamine. Okay. Likewise, when 5-hydroxytryptophan is given, what 5-HT does? It increases 5-HT synthesis. This is the 5-hydroxytryptophan, it is the precursor of the 5-HT. So since there is increase in synthesis of the 5-HT, what is seen in case of patient, the mood it is elevated. So since mood it is elevated, when the drug it is given which increase the level of noradrenaline and 5-HT, and mood it is going down when you give the drug which decrease the level of noradrenaline and 5-HT. This indicate that the depression it is due to the functional deficit of the monoamine, and mania it is due to functional excess of the monoamine. So these are all evidences which support monoamine theory. Now second theory, it is the biochemical theory. So what biochemical theory says, so if you claim that the depression it is due to functional deficit of the monoamine, or there is mania it is due to functional excess of the monoamine, then same result must be reflected when you take the blood sample, or when you take the urine sample, or when you take sample from the CSF, that is the cerebrospinal fluid. Okay, so what generally happen, because these noradrenaline 5-HT they are directly not present in the urine, or they are directly not coming in the blood sample, but their metabolites are present in the urine and the blood sample. So when we say the depression it is due to decrease in level of noradrenaline and due to the decrease in level of the 5-HT, then accordingly the metabolite of this noradrenaline and 5-HT, their level must also reduced in this blood sample or cerebrospinal fluid, or in case of the urine. So if that is the case, then the biochemical theory it is also supporting your monoamine theory, or biochemical theory it is true, isn't it? Now let's see what are the result. So when you study the metabolite of the noradrenaline, that are the 3-methoxy 4-hydroxy phenyl glycol. So this is the metabolite of the noradrenaline and the 5-HT. So it is to remember, I have written it in a short form 3M4-HPG, because HP gas you can remember. So 3M4-HPG, so it is 3-methoxy 4-hydroxy phenyl glycol. It is one of the metabolite of the monoamine. Second metabolite it is 5-hydroxy indole acetic acid. Okay, so these are the metabolite of the monoamine. So when patient suffering from the depression, since there is a decrease in level of noradrenaline 5-HT, accordingly there should be also decrease in level of this metabolite. It must observe in case of the blood sample or urine sample, or in case of cerebrospinal fluid. Now let's see what are the result. So when you have taken the blood sample, that is CSF, blood or the urine, and when you observe their concentration, in case of the first metabolite, that is 3M4-HPG, okay, it is observed that their excretion it is the lower during the depression than during the mania. It means during the depression, excretion of the 3M4-HPG it is decreased. So this evidence it basically the support biochemical theory, or this is in line with your monoamine theory. Because why there is lower in the excretion of this metabolite? Because there is decrease in level of the noradrenaline and 5-HT it is seen in case of the depression, whereas in case of the mania it is observed that there is increase in level of this metabolite. Why? Because the mania it is due to functional excess of monoamine, okay, that is noradrenaline and 5-HT. So this support biochemical theory, whereas when the level of 5-HIA, that is a hydroxyindole acetic acid, in CSF and urine it is studied, it does not show the correct or clear correlation with the depression. Means ideally there should be decrease in level of 5-HIA in case of the depression, and it should be increased in case of the mania, but that is not seen with this metabolite. So although the one metabolite it show the correct correlation, whereas other metabolite it failed to show the correlation between the depression and their concentration in cerebrospinal fluid and the urine. Okay, so this is about the biochemical theory. Last one, rather this is not a theory, but this is the test to confirm that patient suffering from the depression. So you may call it as a neuroendocrine studies, or you may call it as a neuroendocrine theory. Okay, so what generally happen in case of the normal patient? The normal patient, when he suffer from stress, okay, so due to stressful condition, there is release of endogenous steroid in the brain, that is called as the cortisol. When this cortisol it is released in your brain, it basically neutralize the stress, it reduce the stress, okay, and it help the patient to cope up with the stressful condition. So it help the patient. Generally in case of normal patient, it will release in the amount which is required to neutralize the excessive stress, okay. Whereas when it is in case of depressed patient, in case depressed patient, the level of cortisol it is decreased. Since the level of cortisol it is decreased, what happen? The patient will not able to cope up the stress, isn't it? So the stress that he used to cope up during the normal condition, now when he is suffering from depression, he will not able to cope up that stress, because the level of cortisol it is decreased in the brain, okay. So now to check this level of cortisol, what you are doing one test, and this test it is called as dexamethasone suppression test. So what is dexamethasone suppression test? When dexamethasone it is given to the normal patient, what it does, it releases cortisol, isn't it? So in normal patient it releases good amount of cortisol in the normal range. So when you give the dexamethasone and measure the concentration of the cortisol, you will get the concentration of the cortisol in the normal range. But now when patient is suffering from depression, when you give dexamethasone, what it does, an abnormally weak response of plasma cortisol, it is seen to this exogenous steroid, that is dexamethasone. Although you have given the dexamethasone, but level of cortisol in the plasma, it is not as expected, so it is decreased. So if that is the case, this indicates that the patient is suffering from the depression, because this is common in case of the depression, and it reflects there is defect in monoamine transmission, especially in case of the hypothalamus. Because to release cortisol from the brain, what is required? There is these two neurotransmitters are required for the release of the cortisol, that is noradrenaline and 5-hydroxytryptamine. Since this neurotransmitter, their level it is decreased, right? The cortisol release in the plasma it will decrease, okay. And no matter you have given the dexamethasone to release cortisol, but since there is defective monoamine transmission in the hypothalamus will release less amount of the cortisol. So as a result of that, when dexamethasone it is given, the plasma concentration of the cortisol it is not as expected and it is decreased, okay. So this test it is called as dexamethasone suppression test, which is one of the very good diagnostic tests or the confirmatory test for the patient who is suffering from the depression. Because diagnosis it is very complex and very difficult, and it is all based on your history and the Q&A which is asked by the psychologist. So he asked the question, and based on the question he tried to judge where he having the disorder of the mood or he having the disorder of the thought. Okay, so if he has judged that he having suppose the problem of the mood, then to confirm that he may ask that patient to conduct this test, he may prescribe this test, so he has to undergo dexamethasone suppression test, and then only it is confirmed that patient is suffering from the depression. Okay, so this is about the neuroendocrine studies which show that there is a significant or abnormally weak response of the plasma cortisol to exogenous steroid, that is dexamethasone. It is seen in case of the depressive patient. So I have done with my session. Let's go to Q&A. My first question is, among following, identify biological symptom of the depression. So among misery, apathy, low self-esteem, retardation of the thought and action, Which one is biological symptom of the depression? Yes, I am waiting for your answer. Very good. So retardation of the thought and action. So it is right. So Altaf Siddiqui given the answer. Apathy, it is not an biological symptom. Apathy, it is an emotional symptom. Okay. So Saqib answer is right. Retardation of the thought and the action. It is basically a biological symptom of a depression. Okay. So my next question is dot 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 is result from functional excess of the monoamine. Dot 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 is result from functional excess of the monoamine. Very good. Nurun Nisa has given the answer. It is the mania. So the mania, it is result from functional excess of the monoamine. Right answer. Whereas the depression, it is due to the functional deficit of the monoamine. Very nice. My third question is identify characteristic feature of depression, whether it is disorder of mood or disorder of the thought. Which is a characteristic feature of the depression? Whether disorder of mood or disorder of thought. Very nice. Altaf Siddiqui given the answer. Disorder of mood. Nurun Nisa, right answer. It is the disorder of mood. Very good. Uzma, Tuba, Safa, Ashab, Zareen. Right. So it is basically disorder of the mood. It is not a disorder of thought. So psychosis, it is basically disorder of thought. Okay. My last question is name monoamine which is affected by the depression. Name monoamine. Which monoamine it is affected by the depression? Okay. Noradrenaline, Shaista given the answer. Noradrenaline 5T, Altaf, Tuba, Ashab, Sajida, Uzma, Arjuman Logde. Very good. So the point to be remembered, it is occurred due to monoamine which are 5T and noradrenaline. Okay. So it is due to the functional deficit of the noradrenaline and 5T. So these are the monoamine which are affected in case of the depression. So very nice. So I have done with my session. So thanks for watching. If you like my session, then do remember to give me a thumbs up. So I am releasing attendance sheet now.